Good afternoon, everybody, and welcome to this afternoon's session on embracing AI as a clinical partner. My name is Derek Munn. I'm the Director of Policy and Public Affairs at the Royal College. By the afternoon of day 2, I imagine that you're familiar with the housekeeping arrangements, but I believe a slide will appear nonetheless, which will remind us to put questions in the questions tab, to be respectful in the chat tab, that recordings will be available for 6 months, but who knows what changes might develop in the world of AI in 6 months. Please do feedback, and I'm sure you're now all excitedly waiting to see the outcome of the secret code and the point score. Before I hand over to our speakers, I should say, there are few topics right now which get more traction when we are blue skying, future-proofing, strategizing, dealing with challenges facing the profession today than artificial intelligence in all its forms. The RCSLT is engaging on a range of fronts around this. We've already done work around university and pre-registration courses. We need to think about it ourselves as an organisation and employer. We need to think about it in terms of how AI supports work with you as members. But what we're focusing on today is the strand around what speech and language therapists as a profession need to know and engage with. And I can think a few people better to lead us through that than Maria Garcia and Rachel Barton, both of whom have been leaders of the AI for SLTs network. So I'm happy to leave you now in Maria and Rachel's hands. I'll see you for the Q&A.
Thank you, Derek. And hello, everyone. A very warm welcome to our session on embracing AI as a clinical partner and thinking about responsible implementation for speech and language therapists. We're very excited to be here today, and thank you to Derek and the Royal College of Speech and Language Therapists for the invitation to such a brilliantly organized conference. Next slide. So just a little bit about me. My name is Maria Garcia. I'm a speech and language therapist. I work in voice, and I'm also the founder of the AI for AHPs network, which started as the AI for SLTs network, and we'll talk about that a little bit later. I'm passionate about creating free, inclusive, and accessible learning environments for SLTs and our wider AHP colleagues to understand and explore AI and foster innovation in our professions. I regularly hold outreach and training sessions, and I visited many NHS teams and education institutions, and I'm delighted to be this year's AHP Digital Award winner at UCLH. Find me on LinkedIn or take a look at our website, www.aiforslts.com. I'm excited to hand over to my co-presenter today, Rachel Barton.
Thank you, Maria. Hi, I'm Rachel Barton. I've been a speech and language therapist for 30 years, first in the NHS and now in independent practice, working mainly with children and their families in homes and schools. And I also provide professional supervision to speech and language therapists across UK and overseas. Over the past few years, I've become increasingly fascinated by how we can use AI, particularly generative AI, both in our work as SLTs and also to empower our service users. Through that exploration, I've developed resources to support responsible and ethical AI use, and I also run regular courses and workshops for SLTs and other healthcare professionals. I've been fortunate to collaborate with RCSLT, producing the Introduction to Generative AI e-learning module, as well as running training for the European Speech and Language Association and several UK universities. I frequently share my learning and insights online, particularly on LinkedIn. So in this short session, Maria and I will explore the benefits and risks of AI in speech and language therapy. And by the end, we hope you'll be able to distinguish between different types of AI relevant to SLT, identify 6 key applications of generative AI, recognise ethical and safety considerations, and locate resources for further professional development. So what do we mean by AI? AI isn't new. It's been around since the 1940s and 50s, but since ChatGPT launched in 2022, it's become increasingly accessible to everyone. In simple terms, AI refers to computers performing tasks that require human-like abilities such as learning, problem solving, and decision making. And they do this by processing enormous amounts of data, spotting patterns, and making predictions. Now, it's vital to remember that these systems don't truly think or understand, they're calculating, not experiencing. And we've been living with AI in the background for years in Google Maps, weather apps, predictive text, or Netflix or Spotify recommendation engines. These are all examples of predictive AI, which analyze data to forecast or classify information. Generative AI, though, takes things further. It creates new content, text, images, music, even video, based on what it has learned from data sets. And large language models like ChatGPT, Copilot, Gemini, and Claude are trained on trillions of words and can now communicate using text, speech, code, and images. Living in an AI-enabled world has profound implications for the way we learn, communicate, make decisions, and understand what it means to be human. So, what does AI look like in healthcare? And to understand this, let's use an analogy of kitchen appliances. First, I want you to imagine a kettle. A kettle does one job, it boils water. It does this reliably, consistently. You don't need to tell it how to boil, you just press the button and it works. So, specialised AI in healthcare is very much like this. It's built for one specific clinical task, say reading x rays. It's highly accurate at this single function because it's been rigorously tested and approved for that exact purpose. But just like your kettle can't make toast, this AI can't do anything beyond its designated task. Now, think about a food mixer. This is a completely different tool. It can handle multiple jobs, mixing, chopping, blending, whatever you need. But you have to select the right attachment, adjust the speed, and add your ingredients carefully. And crucially, you need to supervise it to ensure you get the outcome you want. So, general purpose AI, tools like ChatGPT or Copilot, work more like that food mixer. They can perform diverse tasks, creating resources, generating leaflets, explaining complex medical concepts. They are incredibly flexible and versatile. But crucially, they can make mistakes or even invent facts, something we call hallucinating. And that's why they always require human expertise to verify their output. So when we talk about generative AI tools such as ChatGPT or Copilot, we need to keep this in mind that these tools can be used to support and enhance the work that we do if they are used safely, appropriately, and under human supervision. So in speech and language therapy, we're seeing both specialised and general purpose AI being used. I've put together some examples of specialised AI tools that are being developed. I'm not endorsing any specific product. These examples simply illustrate what's out there and possible. And I won't have time to go into each of these in detail, but I've included links in the slides so you can explore these in your own time. Many of the tools involve either highly developed automatic speech recognition and analysis, virtual intervention platforms with tools that allow clients to do extra practice outside the therapy room using interactive exercises, virtual reality, or chatbots tailored to their goals, or adaptive AI systems that learn to individualize suggestions based on user behavior. Projects like Mars at City St George's use AI to analyse speech in aphasia. Eva Park offers virtual conversation practice, and Cognishine provides customisable cognitive and language activities. Platforms like Ogma, Say It Labs, and Enuncia are designed to support articulation, fluency, and voice. VoiceIt and Google's Project Relate are designed to recognise atypical or non-standard speech, enabling people with speech or voice differences to use speech-to-text or speech-to-speech technology. Project Euphonia and the Speech Accessibility Project are both research projects that collect diverse speech samples to make automatic speech recognition more inclusive. Beautiful Voice is an interactive platform that gives users feedback on their speech and voice exercises, and Wisp converts whispered or dysphonic voice into more audible speech. There are also a range of tools relating to AAC, including voice banking, creating synthetic voices, and using AI to learn user patterns and make predictions for faster communication in AAC.
So let's think about the role of AI in healthcare delivery. There are a variety of general tools, such as what Rachel has just mentioned, that can benefit us for day-to-day operations, and there are very specific use cases within healthcare. Of course, we see AI doing incredible things in the news, but we're not quite close to having robot doctors just yet. Healthcare is definitely on a different timeline when it comes to thinking about AI as the technology itself is advancing much faster than many of the training opportunities and the governance. AI is very prevalent in detection and diagnostics already, as we can teach AI model variations of what's normal, what's abnormal, what to flag, and when, based on our existing parameters. And we're also able to expand on those parameters using AI to pick things up sooner and more accurately. Let's take, for example, AI interpreting brain scans. So the system will need to be trained up, as Rachel had alluded to earlier, to serve the purpose that we want it to do. So we have to be very careful about what information goes into those models, which data goes into those models, to make sure that we get quality information out. So an AI may have been trained on hundreds of thousands of variations of normal brain scans, so then it's able to pick up what falls outside of that range. And the AI gives us the ability to also do this on a pixel by pixel level, allowing us to see things that perhaps we were not able to see before. We also see AI being successfully implemented within healthcare admin, with documentation relief, with triage support, and also with care plan generation. Its capability to crunch through large sets of data may indeed save us time on tasks that we already do. It's also able to make predictions based on that data, and it might be helpful for things like looking at when people might need treatment for long-term conditions. So with all these capabilities, does AI perhaps help us to see patterns with what we do that we were not able to see before? Next slide, thank you. I've just got an image on the screen here, which is a very nice representation of the ways that AI is involved in healthcare currently, from medical imaging, as we just mentioned, looking through clinical notes, looking through data on electronic health records, all the way to genomic sequencing and looking at data on a genetic level. Next slide, thanks. In the UK, the AI Opportunities Action Plan has been published from the UK government, which covers all of the 4 nations, impressing the importance of boosting AI adoption in the UK and building AI into our infrastructure. It also mentions the need to attract talent and train people on AI so that we can use it safely, effectively, and sustainably. The NHS 10-year health plan for England surrounds 3 key shifts: hospital to community, sickness to prevention, both of which, as speech and language therapists, we have immeasurable value. And the last one being analog to digital. It really highlights the need for us to get to grips with AI, and as the HCPC have suggested, to get to grips with digital skills and new technologies. Next slide, thanks.
So we're going to look at 6 ways that generative AI can be used within our work as speech and language therapists. So these include automating some aspects of administrative tasks to free up time for direct clinical work and achieve better work-life balance, augmenting our decision-making processes. So whilst we need to remain in control of clinical decisions, AI can support our access to relevant information and help us to consider different perspectives. We can also use AI to personalize our resources to service users' needs and interests. Gen AI also offers up some really creative and innovative ways of supporting and collaborating with service users. It has huge potential as an accessibility tool to help to level the playing field for people who have communication differences, and it can also support us in our quest to stay up to date with our own learning. So let's start with automation. A recent NHS pilot found that AI-powered admin support could save staff around 43 minutes per day. That's about 5 weeks a year per person. Results from the trial show that a full rollout could save up to 400,000 hours of staff time per month, equating to millions of hours every year, enabling staff to focus more effectively on frontline care and maybe go home on time too. It's important to clarify that these pilots were using Microsoft 365 Copilot inside of a secure enterprise environment. So, Copilot appears in apps such as Word, Excel, and PowerPoint within a highly secure environment, and this enables the staff to use AI with patient data. This is very different to using public AI websites like Copilot and ChatGPT via your internet browser. It is essential that no patient data is ever input to these public websites. One growing example of automation is the use of AI ambient scribes. So, systems such as Heidi AI or Tortoise AI, which are classified as medical devices, can run in the background of a session with service user consent and then produce a summary of what was discussed. Or the clinician can speak their notes into the scribe after a session. The clinician then reviews and edits this before adding it to the health record, and this part is critical to maintain clinical accuracy. When using AI scribes, we need to be careful about consent and transparency. Clients must know if AI is being used. We need to understand how to operate the scribe and have full oversight, and also how to comply with legal, professional, and organisational policies. The moment we use confidential information in an AI, or there's a possibility that the tool could impact therapy outcomes, regulation steps in. So, GDPR legislation requires a data protection impact assessment for any AI scribe that is used with patient data. NHS England's 2025 guidance requires a clinical safety assessment for an AI scribe to be used in the NHS. Wales and Scotland also have specific guidance on this. I'm not aware of any specific AI scribe guidance for Northern Ireland at this point. And from my own experience, using an AI scribe has totally revolutionised my workflow, lowered my stress, and increased my admin efficiency.
So let's talk about augmentation, which is another way that we can use generative AI as a clinical partner to help us augment information and present it in different ways that would be personalized to the individual, and summarize and synthesize information in a way that's easier to understand. So this doesn't mean that we get AI to do all of the thinking for us. It means that we can actually use AI as a way to support us whilst we conduct our role as the experts. I've put some of my favorite tools on the screen there. There are larger models such as ChatGPT, as we've mentioned, Claude and Perplexity. I'm sure many of us have come across some of those and maybe used them already. And there are more specialist tools for augmentation, such as speech-to-text tool like Flow, visuals tool like Napkin, which creates visuals, pie charts, mind maps based on information that you input. And one of my very favorites is Notebook LM, which is a free AI tool from Google that also creates mind maps, but it also creates video overviews, a podcast, quizzes, flashcards, and all of this is done by you uploading information. So if you're anything like me and working through very big, sort of large, heavy text documents, finding that quite challenging, I would recommend having a look at Notebook LM, and I've got an example on the next slide. With regards to augmentation, I'm going to give a quick sort of made up example here. I'm going to give the example of Leon, who's a speech and language therapist working in the justice system. So Leon works with adults in custody with suspected language disorder. And what he needs to do is brief some of the prison staff and legal advocates on reasonable communication adjustments for hearing. This is something that Leon knows a lot about already, and he's really pulling together information for this training and perhaps refreshing some of his ideas and looking at new evidence out there. So what Leon might do is he might use a bigger model like ChatGPT or Perplexity on deep research mode to help him generate a little bit of an overview of some of the literature out there and the prevalence of communication needs in prisons and effective adaptations out there already. And then what he does is he'll use that information to help him create an evidence summary with all the citations and links and resources. And once the AI has generated that for him, he will absolutely then need to go in and check that for errors, any hallucinations, as we mentioned earlier, any false links, because ultimately Leon is responsible for the information that he's gathering. And AI can be prone to creating errors, especially if we're very narrow with our prompting. So once he finds all the articles and the things that he's interested in, he'll then go in and appraise those just as he would any other research. When he's got that information together and made sure it's all accurate, he'll go in and add his recommendations. He can then go back to ChatGPT or Claude and ask it to create a general overview of the presentation to guide him through when he's delivering it. He might also use it to make something like a checklist to give out to advocates with some of his key recommendations. Before he hands this out to anybody, of course, Leon has checked it. He's checked for accuracy, he's checked for bias, he's checked and removed anything that might be ambiguous, and made sure that he's critically appraised everything. He might also acknowledge the fact that he's used AI to help him put together the resource. And this is something that Leon may have been able to do without the help of AI, but what it's done is it's helped him to put it together quite efficiently and perhaps in less time. He's got to make sure that he's not included any sensitive information, any private information on service users, or any organizational information. And he's tried to be as accurate as possible with his prompting so that he doesn't use excessive amounts of compute power to generate all of this. And in the end, what he's got is a really nice and helpful, useful resource, which really highlights the prospects of collaboration with AI to enhance what we do. Next slide, thanks. I won't go into too much detail, but this is Notebook LM. It is a free tool to use. And what you can do is upload documents, video links, web pages. And what it does is it just works with what you've uploaded, synthesizes that information, and it can generate mind maps, as I mentioned, quizzes, reports, flashcards, a podcast, a video, all about that specific information. And you can also change the output language. So again, another tool that may be a really useful one to collaborate with in our practice. Thank you.
So the third use we're going to look at is personalisation. And this has been a total game changer for me in my therapy work. I made this story using ChatGPT for an 8-year-old boy that I was working with who has a speech sound disorder. One of the things that supported his progress with speech was reading aloud. It really helped him to focus on his breathing, his pace, and on seeing some of the words that he was having difficulty saying. However, he was not keen to practice reading aloud at home. Now, I knew that he was fascinated by space and he was particularly interested in the International Space Station. So I got ChatGPT to write a story at his reading level that was all about the International Space Station. It also created images to match the story. We read chapter 1 in his therapy session and he really enjoyed it. So I asked him if he wanted to take it home. I then got an email from his mum that evening to say thank you. He loved the book so much that when he got home, he read the remaining 9 chapters aloud to his mum and sister. And this is just one of many examples where I've used AI to tailor resources to the level and interests of a young person, resulting in therapy that is irresistibly interesting and rewarding. Of course, when we create materials using AI, we must be alert to bias. AI often reflects dominant social norms underrepresenting age, race, gender, disability, or culture. And that's because it's trained on internet data, which often contains biases. So to counter this, we need to use intentional prompting and critical review. For instance, when I asked ChatGPT for an image of a successful business person, it drew on traditional stereotypes. After adjusting my prompt to avoid biases, it produced this image.
Thanks, Rachel. So that leads us really nicely to thinking about creativity and innovation. There are so many ways we can get creative with AI without the need to input any personal data or any private information. From creating and designing images, videos, and stories, it can also help us to create more personalized resources to use with our service users. AI also gives us the wider prospect of being innovative as clinicians as we get to understand it more. And there are numerous and emerging groups of medical professionals that are using AI tools to help them design their own tech solutions, such as apps or web pages. And as clinicians, some of our main pain points we know the best, and sometimes the best solutions we design ourselves. Now, this won't be for everybody. Not everyone will be interested in creating their own solutions, but it's important to be aware of what's out there. And we also need to be very aware of clinical safety and regulations for digital solutions. So I'm going to give another very quick prospective example here. So in the picture, there is Rowan, and Rowan is an SLT apprentice, busy on apprenticeship in the mental health setting. So Rowan is generally quite a creative person and doesn't particularly have a computer science background, but is interested in tech, in technology. So Rowan's working within a service that supports young adults who, as part of their treatment, have access to virtual reality headsets where they can enter virtual environments, such as a calming environment, for therapeutic support. So that resource is there. But what Rowan has noticed is that sometimes service users are given a headset and said, off you go and have a relaxing environment. And it may not be what they need in that moment. So what Rowan does is they use something called vibe coding to create a VR experience selection tool. So vibe coding is really around being able to code something like an app or a website using AI to help you write the code. Now, you don't need to actually have experience in using code to do vibe coding. And as I said, this isn't something that everyone would be interested in, but it's important to know that if you are interested in trying vibe coding, that specifically for more complex projects or bigger projects, if you don't understand the code or how it works, you can run into problems quite quickly. So AI tools like ChatGPT or Claude are actually really good at writing code that can be translated into apps. And there are several vibe coding dedicated websites where you can input an idea and almost have a conversation with the AI tool to be able to create an app. So what Rowan does is Rowan uses vibe coding to create a tool to ascertain what is the goal of this VR headset session. What sort of mood for the session are they interested in? So for example, the goal might be to relax, but another goal might be to energize. And so in this tool, service users can select with their therapist or self-select the goal and mood of the session. So they might choose a goal to relax. And so the mood, they might choose calm or low stimulation. And then what it does is it generates a suggested VR experience based on what they've got available. It's a much more personalized and empowering way to use the virtual reality accessibility. Now that app could be coded in very little time, and it's brilliant, and it allows, it opens up quite a few possibilities for us. And I'm sure, people can already think of ways that that could be useful. But as I mentioned at the beginning, it's really important to be aware of digital clinical safety. On the screen, I've put a link to a training course from the NHS, which is all about clinical safety. As the slides go around, you'll be able to have access to that and learn more information on what's involved and some of the processes. Lots of AI tools created for use with patients are, of course, subject to risk assessment, clinical evaluation, ongoing surveillance, and human oversights. It may or may not apply to smaller projects like this, but it's important that we're aware that those regulations exist. So an AI scribe, as Rachel mentioned, would potentially fall into the category of a medical device and be registered with the Medicines and Healthcare Product Regulation Agency. It can all seem quite daunting, but for those of us that are interested in this use case for AI, do familiarize yourself with clinical safety. The best port of call would be to get in touch with your clinical safety officers in your organizations, if you have them, digital safety teams, etc., for further information. This is something we also want to support with the network, so please do get in touch if you do have that idea, and we'll do our best to signpost you to the right places.
So when we think about accessibility, I'm going to give you an example of how I used AI within a bilingual assessment. So I was working with a 3-year-old Mandarin English-speaking child with a speech sound disorder, and I needed to understand what was happening with his speech in Mandarin. So I used AI firstly to locate research on Mandarin speech sound development to find out which sounds I would expect to hear at 3 years. Once I knew that, I then asked ChatGPT to generate a list of age-appropriate words containing these different target sounds. A Mandarin speaking SLT verified the list for me. I produced some pictures, and the child's mum then videoed him naming those pictures. So that then enabled me to get an emerging picture of what was happening within his Mandarin speech without obviously being a Mandarin speaker myself. I'm also very interested in how AI can support people who have speech, language, and communication needs directly. And I was very fortunate to meet Tracy Jallow earlier this year, who, aside from her day job, is an expert patient and disability advocate. And she talked to me about the impact AI has had for her in her work life. So she's somebody who experiences brain fog and cognitive dysfunction due to a long-term health condition. And she says that generative AI has revolutionized life for her. She uses Microsoft Copilot at work to write meeting minutes and draft emails. And she says that what used to take her a full afternoon now takes her under an hour. But it's some of the ways that she expressed how she was feeling that really struck me. She said, AI is a breath of fresh air to me. I knew there was more to me. I feel with AI, I'm my full potential that I can be. It's helping me be my truly creative self. It's stories like Tracy's that remind us why democratizing AI matters. AI is an accessibility tool. Whether or not we choose to use it for our own workflow, we have a responsibility to understand how it can support our service users. AI should be accessible, inclusive, and equitable, narrowing that digital divide rather than widening it. And by contributing to AI tool design and feedback, I believe we can influence how inclusive these tools become. So, what does responsible AI use involve? Well, firstly, it's about understanding some basics of how AI systems work, their strengths, their limits, and biases. It's also about thinking critically and ethically by evaluating the tools we use. And lastly, it's about using AI creatively and reflectively. They should enhance our clinical work without replacing either professional judgment or human connection. AI offers extraordinary opportunities, but it's our clinical wisdom and ethics that ensure it becomes a partner, not a replacement. And we don't have formal professional guidance specific to generative AI yet, but many of us are already using it daily. So last year, I published the Pledge for Responsible Generative AI Use in SLT as interim guidance while we wait for more official standards. The resources, including a blog, infographic, decision-making flowchart, 10-point pledge, and detailed examples, are free to download at my website at chatterboxsussex.com. The pledge summarises 10 core principles of responsible use. So these include protecting privacy and ensuring compliance, being transparent about AI use, checking accuracy and recognising limitations, integrating AI responsibly within teams and organisations, preserving our clinical expertise by collaborating with it, not delegating to AI, keeping care human-led by letting AI enrich but never replace the therapeutic relationship, empowering clients to use AI safely to support their communication, and promoting inclusivity and addressing bias in AI. Committing to ongoing learning and ethical use by staying up to date and aware of potential risks such as copyright infringement, and advocating for better AI, which reflects the diverse communities we work with and considers the environmental impact of AI. Maria.
So, thinking about professional development and research, there are several specialized research AI tools out there that are fantastic and supporting us with literature searches. And Consensus is one of those, which we have on the screen at the moment. It searches over 200 million research papers and lists a summary of the findings with all the links and various citations. I've used it many times, and it's a really good start. for a literature search. Within professional development, we can also use generative AI to support with making resources. I know where I work, it can be helpful to create resources about various voice conditions for students or for new starters. We can also use AI as a coach. I've used it several times with the prompt, help me learn about XYZ. Maybe create me a 30-day learning plan from easy to more challenging, and include a quiz at the end. We could also get very creative and practice taking case histories with AI on voice mode. So for example, ChatGPT can ask it to present as a patient or service user with a particular issue whilst you ask the questions. Next slide, thank you. One of the questions that I get often is, what about de-skilling? Many of us will be concerned about this, and rightly so. We don't want AI to do all the brain work for us, and studies already show the effects on our critical thinking, memory, and creativity by completely relying on AI. So it's important for us to understand that as part of responsible use, we need to keep exercising our own skills, our own judgment, our own intuition, and thinking about this as we use AI more and more, and for the future of training speech and language therapists. I've got a lovely visual here from Susan Shelmerdine, who's a brilliant radiologist in the AI space, who speaks of 3 key pillars for personal development when using AI. Know thyself, so be aware of over-reliance on AI. Know thy craft, so deliberately practice preserving your expertise and judgment skills, so seek out opportunities often to do so. And know thy tool, understand AI, how it works and why it can fail. Next slide, thank you. So how do we do that? There are lots and lots of free online tools, how-tos, education platforms, courses, and there's some of them here on the screen. What I found was there was also a need for a dedicated space to talk about the fast-moving AI world within speech and language therapy, and a place to start experimenting and exploring with AI so that we can understand the concepts, especially for those of us without a techie background. Next slide, thank you. So the AI for AHP's network was born from just that. I conducted a survey looking into AI use amongst speech and language therapists. Lots of people were generally feeling positive about AI in speech and language therapy, but one of the key barriers was a lack of upskilling opportunities. The network provides free and introductory learning opportunities, and it is open to anyone in the SLT profession, including students, apprentices, academics, and more. If you're not already a free member, do snap a picture of this slide, or hopefully it works. The QR code on the screen should take you to our free membership. We've quickly gained over 1,000 members, and we regularly host upskilling events where we invite expert speakers on AI to come and speak to us and deliver bespoke sessions. We've had sessions with King's College University, with Microsoft, with Tortoise, all giving us bespoke training. We'll have dedicated spaces for speech and language therapists and other AHP professions to come together and ask questions and inspire innovation in our profession. So with that, I want to say a huge thank you to all of you for listening. We really hope that it's been helpful today. If you've enjoyed the session, please do leave us feedback, and we are here to stick around for questions as time permits. Thank you.
Thank you, Maria, and thank you, Rachel. I can tell you right now that there is no possibility of getting through all the questions that have been submitted, because there are many, many. But we will attempt to deal with as many of them after the session as we can. Absolutely fascinating. I should say, Rachel mentioned that we don't currently have principles for the profession beyond the work that she herself has done. I'm pleased to say that the RCSLT's draft principles have now been prepared, and we'll be going live with those sooner rather than later on the website to complement the CPD resources that are already there. Now, in some cases, colleagues posted questions which you then answered or partially answered later in the session. but I'm still going to go with them because I think they're important. And I have to say, the runaway winner in terms of the numbers of people posting and agreeing was to ask for a bit more about the environmental implications of AI and what you think about it. And it's something I'm acutely aware of as the lead person in the Royal College for both AI and for sustainability. I'm acutely aware of that tension. But just to kick off, do either of you have any further reflections on the environmental matter?
Do you want me to
absolutely.
kick off, Maria? Or?
Yeah, go for it, Rachel. I'll jump in if needed.
Yeah, so I mean, just to say, it's sort of it's not it's quite a kind of a grey area in some ways, in that, yeah, absolutely, it uses a huge amount of energy. We know that. We also know that by using AI, sometimes you're saving a lot of time on something that you would have spent a huge amount of time on anyway. But I guess the thing is, from my perspective, is that there is not a huge amount that we can do at the kind of at the top level in terms of how those tech companies are operating. And actually there are quite sort of strict guidelines now that they're kind of following in terms of their developments. But what we can do is that we can get better at our own AI usage. So one of the things that we've done within the network is I wrote an article for our last newsletter around just some kind of top tips for you as a therapist on the ground using AI, things that you can do that actually will reduce your carbon footprint when you're using AI. So I think there were sort of 8 different tips for being more sustainable. One of the best things you can do is actually get good at prompting skills, because actually you'll find when you start to use AI, you can have a lot of to and fro and it doesn't quite give you what you want, and you disappear down a rabbit hole, and before you know it, you've sort of spent an hour and you haven't got anything really to show at the end of it. So one of the things that we focus on is how can we get really good at writing that prompt so that the output that we get, we get to much sooner, much closer, and actually therefore we've used a lot less compute power. It's a little bit like the whole, sort of plastics issue. You sort of feel like, oh, if I use a reusable cup rather than a plastic bottle, is it going to make any difference? But actually it's about the sort of the collective strategies that we can employ to actually, sort of be really mindful, I guess, around how we're using it. And, for instance, as well, a text output is a much lower energy use than an image output, than is much lower than a video output. So again, it's thinking about what modality do you want, and actually, do you really need an image for that, or actually have you got one in your library that you've already used that you can go back to? So it's some of those small things that I think we can physically do. The larger picture, obviously, to some extent, is out of our hands. But yeah, Maria, if you want to add anything, do. So.
Yeah, absolutely. I think I'll echo what you've said, Rachel, definitely. And I think, with sustainability, it's very important. It's part of, as one of your principles, Rachel, being responsible with AI. We've got to think about how much we use it in the same way that we'd think about how much we use Google, for example, which also generates compute power, not to the same level, but we also think about how we use that sustainably. I think that there's a balance where actually AI can help us with sustainability. And I've actually just won a funding bid for a sustainable project using AI in speech and language therapy. It can save us a lot of time. It can save us a lot of journeys. It can save us a lot of compute power and emissions, but also we do need to think about it. So I would echo that, really, on a clinician by clinician basis, understanding the tool, understanding how it works, will help us to be more familiar of when we want to use it and when we might not.
There is also, just to add in, there is also the thought that generative AI is going to be part of the solution to solving the climate crisis with the invention of quantum computing. And that will really, really bring down the sort of the energy that's used in computing. So kind of in a way, it's creating a problem, but it might be part of solving a problem as well. So yeah.
Absolutely.
Thank you. Okay, I'm going to try and get 3 more questions in. 2 of them are immensely practical, but the first is philosophical. It's almost like confession corner. Somebody says, Do you have any tips for avoiding getting overly reliant on AI? This anonymous member says, I find myself turning to it, perhaps too often, when I should be thinking for myself.
Yeah, I think that it's a very, very good point, and I think it's crossed many of our minds. We mentioned, I think, after that question came through, the pillars of actually trying to avoid de-skilling, and I really hone in on know the tool. I think there's like almost like a rite of passage where you kind of use AI quite a lot, and then you understand its limitations, and you're a bit more choosy on what you might use it for. So absolutely, and seek out those opportunities to keep practicing judgment, intuition, and you kind of have to kind of keep that going for yourself as responsible AI users. Yeah.
I think you can ask the AI to coach you. You can sort of say, I'm struggling with this issue. This is what I'm thinking at the moment. Can you bring me some different perspectives? Can you play devil's advocate? So use it like you would a kind of a person in a way. Like you wouldn't walk up to a colleague and go, tell me the answer what to do here. You'd be more likely to say, I've got this tricky issue. Can I just explain a bit about it? And then can we have a conversation? So the more you kind of engage with it actively, and this is what the research is starting to show, active use of AI actually develops our critical thinking skills. Passive use absolutely will erode our skills and we'll forget how to be speech and language therapists. So I think it's a question of noticing if you are becoming over reliant and thinking about different ways. See it as your collaborative kind of companion, not as an answer machine.
Yeah, absolutely. Know your skills, know your craft, and know your tool.
Thank you. And that relates to other questions that have come in, talking about the holistic nature of SLT versus a machine, and how AI can support assessment without replacing our clinical judgment.
Yeah, I think that it can absolutely support assessment, but it may be at this point in time that we're thinking about how can we use AI to support us so that we're actually more free and more able to actually get to those assessments sooner and more efficiently. So, for example, I think what's become most prevalent is helping with the administrative burden and taking away some of those things that do take up quite a lot of our time. So getting support with that so that we can go and be the experts. But it's a really big topic. I think it's a really big conversation, and it's part of what we'd like to do at the network is host some of these conversations as well, and sort of get people talking to each other. How do you use AI, and what are you doing, and be able to exchange those ideas. I think it really warrants those discussions.
Thank you. More practical. Can AI help reduce waiting lists by automating parts of screening or triage?
Wow. In theory, yes, it could, but that is a much sort of longer term project because if an AI is actually doing decision making, that's an entirely different thing than if the clinician is in control. Obviously, AI does make those kind of sort of decisions in other areas of healthcare. So I would say the theoretical answer is yes. The practical answer is that there's going to be a lot of work to do in order to get there, because as we know, AI systems are quite biased. You really need to look at what populations, what demographics that, those processes might be missing out on. So there are examples in healthcare where AI has been brought in and actually then has disadvantaged certain aspects of the population. So yeah, Maria, do you want to add anything to that?
I think you're right, Rachel. It's a really big topic, and I think we need to be really careful with it. I would almost echo what I've said before, in that actually how can AI support us to be able to get to those assessments more efficiently, more quickly. If we think about something like an AI scribe, that actually allows us to connect more with who we're treating. It's actually a use of AI that is actually not in the way of our session and not replacing anything. It actually allows us to have those conversations. And I think in terms of assessments, the capability is out there of an AI listening in and picking up things in speech samples and things like that and making assessments. I mean, that would all be down to the quality of a tool that was created in collaboration with speech and language therapists, and would be a huge, huge project. So I would just echo that actually, if we can get AI helping us with certain aspects of the role, that will allow us to be able to spend more time on, on those assessments.
And that's why we need to be involved from the start in any kind of tech development to make sure that those data sets are diverse enough. And, there's some amazing technical people out there who have got such skill in developing these systems, but actually if speech and language therapists are involved in those discussions right at the start, you're much more likely to get something that, sort of comes out that is actually useful, reliable, etc.
Brilliant, thank you. Last question. It's quite specific to children's services in England, for reference anyone who's been in the SEND reform sessions over the last day, but it's specifically around local authorities making use of AI to write education, health and care plans, potentially at volume. And it invites presenters' views on this.
I mean, yeah, it's an interesting one, isn't it? Because I would say that education, health and care plans, as speech and language therapists, we perhaps don't feel fully confident about the way that they are sometimes written by humans. And so I don't think we should absolutely kind of jump and say, gosh, that would be a terrible thing if AI was writing them. But I think what we need to kind of come back to is the fact that AI assistance is very different to an AI just churning something out. And that's what we have to kind of hang on to, is that this is a tool, this is something to collaborate with. If we're finding that humans have been completely missed out of the loop, and that's a sort of a phrase that's used a lot within AI, is human in the loop, then I think there's a case to be worried if that system hasn't been thoroughly tested. And I suppose that would be my concern, is if AI is being used to write education healthcare plans, who's done the testing of that system, who's kind of audited what's coming out at the end of it. But we know they're not perfect to start with, and actually there's a huge backlog and children are waiting a long time. So I think we have to be open to the possibility that actually AI could be a positive force within that process.
Yeah, absolutely.
Brilliant. Thank you. Maria and Rachel, thank you so much. It's clear from the comments that conference goers have found this session just as helpful and informative and stimulating as I knew they would. I look forward to continuing to work with you closely in the months ahead. That brings us to the end. I think there are 2 more sessions to go for those of you who are carrying on to the bitter end. You know the script by now. There'll be a secret code appearing to gain more points that you can also gain for doing feedback. There it is, not so secret. And thank you once again to Maria and Rachel. Thank you to all of you who attended. Good afternoon.
Thank you. Bye-bye now.
Thank you.